Good morning, everyone. This is Christopher Middleton with Messer Financial. Today we have the pleasure of listening to Tom Bland, who is the sales manager of Senior Market. And he's going to be talking about the new Pan American Medicare Supplement product. As always, email your questions during the presentation and we'll read them at the end. So without further ado, I'll give you to Tom.
Good morning and thanks, Chris. It's my pleasure to be here this morning and share this information with your teams. We're going to talk this morning about the Pan Am Medicare Supplement. I've done extensive research. I have a lot of data. I can direct your brokers, your agents into areas where this is a very competitive product. And I've got some slides included here to show some examples. First, a little bit about myself. I've been in the insurance business for quite a while. I was first licensed at the age of 19, been resident licensed in 3 different states, currently licensed resident in Florida and non-resident in about 26 other states for life and health and about 30 states for property and casualty. Own my own agency for about 15 years, been with Pivot since April. They launched this product in May. We've been doing regular webinars, one-on-ones, things like that ever since then, trying to, spread a little information about this. So first, we'll start with a brief company overview. Who is Pivot Health? Pivot was launched in 2016. It's a product development management and marketing company. Pivot is not an insurance carrier. We're a marketer. We develop products. We go find an insurance carrier that can put it together, and then we market it. The goal is to provide insurance solutions to the individual marketplace. And in 2018, Pivot was acquired by Healthcare.com, who's ranked 583 on Inc. 5000's fastest growing private companies. We have 2 main business units. The comparison side, which is Healthcare.com, that's where consumers will visit and they'll compare whether it's short term, whether it's med subs, whatever the product is, they'll compare there. And then we have the coverage side, which is Pivot Health. That's where we reach out to brokers, get them contracted for our products, and do that, the marketing, the support side of Pivot Health. And in 2020, like I said earlier, the MedSup was launched through Pan American Life. Excuse me. Why would you sell Pivot Health's senior products? Yeah, I'm going to show you. Our goals: to be best in class, to build tailored products, and to lead the industry in agent support and customer service. Very simple ideas, sometimes a little bit more difficult to actually perform. We have a strategy, we like to call it the 60+ strategy. So we developed a strategy for the 60+, and it is providing products that will take someone from 60 to Medicare. We're committed to the market space. We've created a value proposition that allows you to provide health insurance coverage for an entire household. We're going to go over that as we progress through these slides. We have the Bridge to Medicare product, which is in 9 states, a 3 by 364-day short-term medical starting at age 60. And we have the Medicare supplement for Medicare eligible clients. So the pre-Medicare market is, we call it healthcare solutions for those that are age 60 to 64 and 11 months. And that's about 12 million of the 77 million baby boomers in the US that are between the ages 61 and a half, 64 and a half, 28% of the population. 50% of those have incomes that make them ineligible for Affordable Care Act subsidies. So then the Affordable Care Act ceases to be affordable. Approximately 50% of seniors will start researching Medicare plans at age 63, and that number jumps to 80% at 64. So they are actively researching their options for Medicare long before they're eligible for Medicare. So we have our bridge to Medicare plans that are designed for those age 60 to 64 and 11 months in good health. Early retirees are a great segment of that population. They're 60 and over. Sometimes they may have had different short-term products. They may have had different products, and now they find themselves in a situation where either because of their age, because of premiums, whatever, they're looking for something that's more tailored to them. The self-employed, sometimes they're not going to qualify for group health because they're self-employed. They're a good segment of the population. And for those that have decided maybe they're going to leave their jobs early retiree, and they get that COBRA paperwork and they find out that COBRA is not really an option for them. And it's an economic alternative for a spouse not eligible for Medicare. Prior to coming to Pivot, I worked for United Healthcare here in the Tampa area for several years. One of the most frustrating things for me was I would get those leads from United Healthcare corporate. I'd go call on maybe a Medicare, soon to be Medicare beneficiary, get them on board, do a great presentation, they're all in, and then the question comes up that, I'm going to retire, I'm going to lose my employee group health. What do you have for my husband? What do you have for my wife? Well, with United Healthcare, they didn't have an option. They didn't have bridge to Medicare. They didn't have short-term medical that was offered or that I was even able to offer for a spouse that was not yet eligible. This is a great tool to have in your toolbox. So what exactly is the Bridge to Medicare plan? It's a short-term medical insurance solution. It can provide coverage up to 3 by 364 days of coverage. And what they do is they take those 3 plans and they stack them end to end. So in the, after the first year, it automatically renews to the second policy. There's no new underwriting. Once they qualify on the front end, they're good for those 3 by 364 days of coverage. Now that, like I said, that's in 9 states. We have an additional 12 where the State Department of Insurance will let us do 2 concurrent policies or 2 policies stacked end to end. And then the majority of the states where we're licensed and approved in, it is individual 364-day policies. So we've got 3 plans bridged to Medicare. You can see them. We call them Plan 1, Plan 2, and Plan 3. They all have different deductibles, different coinsurance, and different coverage limits. You can see from the list of benefits there that just about everything that individual would require is covered. The features of the plans are 3 simple designs, issue those 3 policies, freedom to choose any doctor, any hospital, no networks, and all 3 plans had prescription drug coverage after paying the deductible. And benefits fit the client's needs. If somebody is, say, 25, 30, 35, they're going to be different, benefits that they'll need that somebody that's 60 plus may not need. So these plans are tailored to that demographic. So the portfolio of products for the 60 plus strategy is an expanding portfolio. It helps to decrease lead acquisition costs. It increases the customer lifetime value. At age 60, 61, 62, that client is going to search you out for whatever their options are. Once you get them in your pipeline, you'll become that trusted advisor. So when they get near Medicare beneficiary age, the first person, like our slide previously showed, at 63 or 64, when they're researching their options, they'll come to you with questions, and you don't have to worry about that Medicare, prospect. They're coming to you because they're already in your pipeline. So you've got the Bridge to Medicare plan, you've got the Med Sup, And a new thing that we offered beginning back in July was what we call Health Values. Health Values is non-insurance, medical supplement. We've got a couple slides talking about that, featuring free and unlimited telemedicine. One of the things we found in this age of coronavirus is more and more people are willing to use telemedicine than before. They don't want to go to the doctor's office and sit in the room full of people with their masks on for however long it takes to see the doctor. Telemedicine, I've used it myself. You can log on within probably 5 to 10 minutes. You're talking to a doctor, a healthcare professional. You're getting, the attention you need, and you're done. And also through that Health Values, there's diabetic supply discounts, probably the best advantage with the Health Values supplement there. We're going to talk briefly about Medicare 101 for those of you that have, done the senior market, and some have not. They're interested in getting in the senior market. So we're going to talk about Medicare, the parts of Medicare. Part A is hospital, Part B is the medical, that's all the other services, doctors, skilled nursing, whatever is your Part B. Your Medicare Advantage is Part C, and Part D is your prescription drugs. With a Medigap or Medicare supplement, there's a 6-month period for what we call open enrollment. Begins on their first day of the month that they have their Part B effective. Now, in this example, we're showing that it's, your birth month of your 65-year birth month. Some people may delay their Part B. They may want to work till they're 66 and a half, 67, 68, 70. And it coincides with your Part B effective date, and it extends 5 months beyond. A little different than Medicare Advantage. That is 3 months before your 65th birthday and 3 months after, and you're actually a 7-month opportunity. With MedSup, it's 6 months. Now, I think we talk about some guaranteed issue periods. There are 8 of them that Medicare and state departments of insurance identify. We're not going to cover those in this training. This is just about the open enrollment opportunity. I've got a screen capture here of the actual customer-facing brochure that just outlines a little bit. The page 1 here is your Part A hospital coverage. On the left, it talks about what Medicare pays, and then the different plans we have is we have a plan A, F, G, and N, and what the coverages are, so that the customer can understand what their responsibility is going to be with the MedSup. And then here's the second page, and this is your Part B benefits, so that they can see what Medicare covers and then what the MedSup will cover. So the benefits of Medicare supplement plans in general are your insureds can choose their limits of risk. Now, if they want, if they were eligible for a Plan F, or they get a Plan G and they want to pay that Part B deductible, or they want the Plan N where they've got deductibles and copays, it's up to them how much they want to pay for the premium, and then how much risk that they're willing to take. Even Medicare Advantage plans have limits of risk. It's known as your maximum out of pocket. So if you've got a customer and they're looking at that and they're willing to accept, say, a $5,000, $6,000, $7,000 maximum out of pocket limit of risk, then that's their limit of risk. If they choose a MedSup and they're going to add up their Part B premium, and they're going to add up their MedSup premium, and say it comes to $200, $250 a month, and they're willing to accept that $2,400 is their limit of risk. It's just whatever that client is up for. And with a MedSup, you've got no networks, no referrals are needed. If the doctor accepts Medicare, they'll accept the MedSup. And Plan N closely mirrors employer group health insurance. Some people are comfortable with copays and a small annual deductible in exchange for a lower premium for a plan N. Something to, use in your toolbox. When that customer sees a, $110 or $120, MedSup premium, the plan N might be something to pitch. And probably, in my opinion, the most important aspect is complex medical decisions are made by Medicare based on Medicare rules, relying on your primary care physician rather than a large for-profit insurance company. Like I said, I worked for United Healthcare. Never really dealt with those, but those large insurance carriers, they're still in a Med Advantage situation. They're still looking at, decision making. They're for profit, and that's what's going to, direct their decisions. So the advantages of selling Medicare supplement plans in general are you've got a fantastic market opportunity. 10,000 baby boomers turning 65 every day. That's going to continue until about 2030. It's an underserved market. It needs insurance guidance. Medicare can be very confusing. I can't tell you, since I started 2014 focusing slowly on the senior market, how many not only clients I've encountered that were confused, but agents can be confused. They can be a little bit unsure about Medicare. They can be a little bit unsure about the things that are covered. So it's a very, underserved market in the fact that they need trusted advisors that can direct them, that can guide them, can educate them on what the Medicare that they worked for either 10 years, 40 quarters. Some of them worked their entire working life and paid into their Medicare. Now they want to know, what are my benefits? And your current book of business is your initial lead source with relationship selling. You've already got the customers in there. You could be a full service agent and you could have property and casualty customers. You could be a life insurance agent and you've got, life clients. That's who you want to target is your initial lead source, is your book of business. So the advantages of selling Medicare supplement plans are no certifications are required. You don't have to go through AHIP or special carrier trainings. MedSups are regulated by the State Office of Insurance. You can sell them year round. As we stated earlier, people are delaying their Part B. They could call you, a year, 2 years after they turn 65. It's something that you can sell year round. You don't have to wait for AEP. You don't have to wait for OEP. You don't have to wait for an SEP. So Pan American, we talked about Pan American Life Insurance Company and their Medicare supplement plans. Pan Am Life Insurance Company was founded in 1911. They have a whole, portfolio of insurance products that are reliable and flexible. They're in 22 different countries, and they're protecting almost 6 million lives. As far as their stability, they're AM Best rated A excellent and Fitch rated A strong. As I stated earlier, we have the plans A, F, G, and N. Available in 29 states. I've got a map that outlines those states. We have what we call a roommate discount, up to 12% in some states. And I call it a roommate discount. Pan Am actually refers to it as a household discount. It's very flexible. It's very liberal. I've got a slide dedicated to explaining that. A very simple e-application. 15-minute application process. If you have used any of the e-apps for life insurance, for MedSups, whatever, you'll know that that application process, especially if you're doing it over the phone, can sometimes be frustrating. This is just a 15-minute. Once you have done a few, you can pare that down to probably 8 to 10 minutes. We have the e-signature and the voice telephone signature options. I highly recommend the voice telephone signature option, because at the end of the filling of the application, you submit it, you do a 3-way call with your client to an 800 number. They're prompted for 2 4-digit PIN entries. and that completes the voice signature process. And we have, of course, very simple claims process. So I always get the question about, I thought Plan F was discontinued, and the answer is very simple. It was discontinued for Medicare eligible seniors after January 1 that are eligible for that. And as I said earlier, you've got some people that are delaying their Part B, they're holding off on their retirement. So if they were eligible before January 1, 2020, they may be able to buy a Medicare supplement plan. You want to check in your state, what those rules are for that, but most of them will be eligible for that. So most seniors know what they want. They just need a little help finding it, as I touched on before. They need a little guidance. This is our map of where the MedSup is available. Blue states are where we're approved. Green states were not yet approved, and those golden yellow states up there in the Northeast are not even licensed in those states. And as you can see, Missouri is pending. So what I did, I took CSG data and I created this heat map of the states that we're in. You can see Florida and Missouri, they're in red because we're not very competitive in Florida. It's a pretty competitive market down here. But in the other states, the lighter blue colors were competitive, and as the shades get darker, we're more competitive. And I've got some examples from some of the different states. And if you've ever been solicited by somebody for a MedSup, you may get that solicitation in the mail, and they'll give you an example of rates for like Waterhole, Montana, where nobody lives and nobody's selling MedSups. I've taken, some of the larger cities across the country, Chicago, Denver, Memphis, Tennessee, Tulsa, Oklahoma, places that we've actually heard of and we know exist and have large populations, and giving you some premium rate examples. And these are based on a female age 65, no tobacco Plan G with household discount, April 1, 2020 issue date. So what I did was I broke this down into heat maps for each individual states, and you can see that this is in Indiana, and up there in the northwest corner, the yellowish, orangish, reddish dots are places where we're not competitive, and the blue dots we are. The darker the blue, the more competitive it becomes. That way you can look at your state and see those areas where you want to concentrate your either prospecting or your marketing. If you're going to buy leads, I've got that information by zip code, by zip 3, where it's an entire series of zip codes where we're competitive with the information. Then what I did was I took each individual state. I took Kansas, for instance, in fact, Kansas City, and I looked at the top 3 carriers there, which is AARP, Blue Cross Blue Shield, and Cigna, and I compared it to the Pan Am MedSup with the premiums, and you can see it's anywhere from $4 to like $9 cheaper than those top carriers. I took Houston, Texas, compared it to the top 3 there, which is Blue Cross Blue Shield, Mutual of Omaha, and of course AARP, and I compared it. It's anywhere from $1 to $12 cheaper than those top carriers. And then finally Columbus, Ohio, and I compared it to AARP, Anthem, and Humana, which are the top carriers, and you can see that it's as much as $15 cheaper there. So I won't say it's a secret, but what I did was I reached out to our top sales agents so far, and I asked them, what are you doing to close so many sales? Their overwhelming answer was very, very simple: offer it. As in the previous slides, if you present the product to your client, most of the time, we found probably 80% of the time, they'll choose the most inexpensive one. They'll find out, what their opportunities are, what their options are, who the carriers are. And a lot of them, they may see that, 5 or 10 commercials a day for the AARP MedSup, and they may, really want to do the AARP. But because a MedSup is a MedSup, Plan F is a Plan F, Plan G is a Plan G, most seniors are on fixed incomes. Every dollar counts. That $10 or $15 a month may make a difference to them. So what makes the Pan Am plans unique? Well, Pan Am pays daily commissions. They have an easy online enrollment, up to 12-month advance options. We have an instant underwriting for issue, either issue or decline on the spot. Even before you complete the application, you'll know whether it's going to be issued or declined. We have very simple online contracting, very quick, real simple. And for large MGAs, GAs, whatever, we have a flexible commission hierarchy. I talked earlier about the roommate discount. And what we found was applicants residing in these states right here. And I took the verbiage right off the application. And it says may be eligible for household premium discount if they currently have a household resident who is age 50 or older with whom they have continuously resided for the past 12 months. So that's the first part of it. If they just have somebody else in the household, doesn't have to be a family member, doesn't have to be somebody signing up for the SUP, just somebody 50 or older that they've resided with for the past 12 months, or to whom they're married or in a civil union partnership. So in these states up here, just having another person, it could be a younger sibling, it could be an elderly parent. As long as they're in the household with them, there's no more than 3 of them there, they qualify for the household discount. In these other states, there are additional rules. Those ors may become ands. So you need to find out the states that you're writing in, what the rules are for the household discount. As I said earlier, the e-app is very simple. What Pan Am did, they took their regular paper app, turned it into a PDF, and used a technology called Firelight to make it a fillable form. And you'll notice in this screenshot, which is not a very good screenshot, I admit, but you'll see these pinkish fields. Those are required fields. The yellowish, beigeish fields are optional. And if you have the paper app or you're familiar with the e-app, you're able to do the other one because it's an identical layout. You know, one is the same as the other. One is electronic, one's paper. For the e-app e-signature, they need an email address. You have to wait for them to open the email. You have to wait for them to check the email and complete the process. That's why I say the voice signature is really a whole lot better. Our health values, you can add it to any med sup for as little as $19.95 a month. It's non-insurance benefits, powered by Navigo Health. Express Healthcare, the free and unlimited telemed benefit, includes dermatology. Some don't. They're assigned a healthcare liaison. It's a member advisor, helps them save money on medical and pharmacy expenses. There's an up to 70% discount on durable medical equipment. The diabetic testing equipment is a great add-on, a feature to this, delivered directly to the member's home. And there are more. We've got a flyer on this we can provide, you know, with those brokers interested in offering it. So the advantages of selling the Pan Am MedSup with Pivot are you have products that provide health insurance for an entire household. You have the bridge to Medicare. You have MedSups up to 12% discount with the instant underwriting. You have access to Health Values memberships, member benefits, free and unlimited telemed, daily commission payments, and bonus opportunities. We're going to talk briefly about the bonus opportunities. Everybody likes cash. So effective August 10th and running through September 30th, agents can earn a $100 bonus for each and every app submitted and issued. Now, there are conditions. You might want to get a hold of the flyer and read it, but it's up to, well, it is a $100 bonus for every app submitted and issued through September 30th. Do 10, it's $1,000. Real simple math. We had another bonus promo that ran up until the 1st of August, and it was like a graduated promo. This is, you know, just real simple, $100 each and every app submitted and issued. So our closing thoughts: freedom. Customers want freedom, brokers want freedom. But the freedom that the customers want is to use healthcare professionals without restrictive networks. Both plans, whether it's a Bridge to Medicare or it's the MedSup, are designed with that in mind. Opportunity, well, everybody likes opportunities, and with more than 10,000 baby boomers turning 65 every day through 2030, there's a huge potential of opportunity using your existing book of business. And as a trusted advisor, you can provide solutions for the entire household using a 60-plus strategy. Allows you to provide those solutions for Medicare recipients as well as pre-Medicare individuals. So now we've reached that time where we're going to start talking about questions. You can email them to me. I think Chris is going to open it up for questions from anybody on the call.
Thank you, Tom. While we wait for some questions to roll in, going to mention a few things about Messer in general. So if you're interested in this product, feel free to go to our messerfinancial.com under agent resources and online contracting and request this carrier. If you have any questions about commissions or product information, you can reach out to producer support at messerfinancial.com and we'll be able to assist you with that. We also have Pan American on our senior quote tool, so you can always get rates from that portal. And if you don't have that portal, you can again go to messerfinancial.com under quick links and quote tools, and you can request access to that quote tool. It's a very good quote tool. It does a Medicare supplements, Medicare Advantage, hospital indemnity plans. So it's a really good resource to have. Let's look at some of these questions right now. Are you offering service in Florida? I think you already talked about that, right?
Yeah, it's not very competitive. We've got about 4 counties, a couple of really good zip codes where it is competitive. In the rest of the counties, it's somewhat competitive. It might be within a couple bucks of the same of the top carriers, but yeah, it is available there.
Okay, and the next question is about what is the commission rates. You have to email or call into producer support at messerfinancial.com, and I'll get those rates out to you. Where can I find the zip code competitive map for North Carolina?
I can get that to you, Chris, and then you can forward it. In fact, I can send you all those maps and the zip code data, and then as they come in, those questions come in, those issues come in, you can deal with it. You can send it to them.
All right, thank you for that. Are there any more questions? All right, wait a minute, here's one. Let's see. If we have a client new to Medicare this year and spouse has unfavorable health plan that he cannot get rid of until next year, he is 64 now, how is the best way to help him with Pivot Health?
So he's like stuck in that plan, so he can't go with the Bridge to Medicare. Is that what the?
I think that is what the agent is saying.
Okay, well, I think if they're Medicare eligible, they can go with the MedSup. If they're locked in, there's not a whole lot you can do for them. If they're not, they'd be a good candidate for the Bridge to Medicare.
Okay, what if Biden wins the election and makes Obamacare mandatory? Where will the under 65 health coverage end up? I think that kind of remains to be seen.
Yeah, and it's an individual state type of a situation. I don't know that, even when we had that, early on, when we were dealing with Affordable Care Act, you could still go out and buy short-term medical plans yourself because they were covered as far as, being creditable coverage under the Affordable Care Act. But anything can happen. You know how that is.
Okay, I've got a follow-up answer about the Bridge to Medicare question. He says yes, only his wife is on Medicare. I guess my question to the agent is, so I'll call the agent and discuss it with him.
Okay,
Because I think I need to ask a couple more follow-up questions about that one.
okay.
This question about, does the client have to be a citizen of the U.S. basically to purchase Pivot Health supplements?
Well,
Can
they
you
have
sell
to
to green
be
card holders?
if they qualify for Medicare. That's, and we have had, resident aliens that had been here for however many years and they qualify for Medicare. That's they do not have to be a citizen, but they do have to qualify for Medicare and they have to be Medicare eligible.
Okay. All right. I think that's all the questions we have, Tom. As always, thank you for your participation. Thank you, agents, for listening to our webinar. I will get out the information and the slides to you as soon as possible. If you have any other questions, feel free to reach out to Messer, producer support at messerfinancial.com, or our toll-free number is 866-568-9649. Thanks to everybody and have a great day.
Thanks, Chris.